Director General, my fellow Ministers of Health and other representatives from member countries, Chairperson, Assalamu alaikum and warm greetings from Maldives. At the very outset, I wish to state that in this time of an unprecedented global public health crisis caused by the COVID-19 pandemic, peoples and nations, and above all, we Ministers of Health need to stay ever more focused, resolute, and lead the efforts to overcome this calamity. For countries as well as for WHO, this crisis has taught many lessons. That no country or the world could predict a crisis of this nature or magnitude, that the less obvious consequences or collateral can be as impactful. As countries exhaust all their resources and energy on COVID-19, there may be other neglected health issues and health system needs, as well as socio-economic fallout from this crisis. Therefore, in my opinion, we need to look beyond and the aftermath of the pandemic. Another important conclusion we can draw from this crisis is the importance of health in all spheres of life, be it economy, be it environment, or any other aspect of life. The primacy of health cannot be undermined. When the world is faced with global health crisis, it is all of humanity that suffers. Mr. Chair, just like other countries, and despite early and rigorous efforts, Maldives was unable to prevent it from our shores and had to face its consequences. On one hand, the freeze on tourism activities and fishery exports were affecting our very livelihoods, while on the other, manufacturing countries were placing embargoes and global movements of goods came to a grinding halt. This affected us badly, impacting our containment efforts as well. Medical and other supplies were becoming very hard to procure and import. Here I wish to laud and appreciate the regional leadership by WHO Regional Office and bilateral assistance from neighboring countries, particularly that of India. And although not from our region, we also wish to note the assistance from China. Maldives China has enjoyed decades of cooperation based on our commitment to One China policy. Indeed, we can contain this pandemic only through regional and international cooperation, and when all countries start working together and sharing critical information and resources. Viruses do not recognize borders. Together as one world, we can overcome COVID-19. Thank you.